My name is Margaret Van Vliet. I'm an independent consultant and have the privilege of advising CUNY Foundation on some of their housing strategies related to opportunities for folks with intellectual and developmental disabilities. And we've had a terrific run of panel presentations yesterday and today, and we're really glad to see you here for this final of our presentations for this year. Really centering on fair housing and equity and how we can think about the gaps in services for this population in the context of folks ramping up their understanding of fair housing and equity considerations. So I'm pleased to be joined by a really terrific panel. We have Jake Cornett from Disability Rights Oregon. We have Kurt Toombs, who's going to join us from via Zoom from Eastern Oregon Center for Independent Living. And we have Matt Serres from Fair Housing Council of Oregon. So I'll get us kicked off with a couple of introductory kind of framing comments and slides, and then we'll get into the meat of it. Okay, there it is. If you were here for any of yesterday's panels, you will remember, you may know or have learned about this. Whoops, what am I doing? Is this it? Yeah, this is. Okay, here we go. Echo Northwest did a study a couple of years ago at the behest of CUNY Foundation and found what those of you who may be in the IDD services field already knew, and that is that folks with intellectual and developmental disabilities are undercounted and underrepresented in our systems of care. And that the folks in this population group actually face disproportionate barriers to housing security and housing stability. And we're going to talk a little bit about why that is today. And so in this moment in state and federal government, when there is, happily an increased emphasis on thinking deeply about equity and inequities, and the way that makes, we need to think about tightening up and bolstering our fair housing laws and regulations, that we need to be cognizant of the unique barriers faced by this population. So as I said, we've got 3 experts here to talk to us about that. We don't have an expert running the PowerPoint, but that's okay. So this is an excerpt from that data study. And if you're interested, you can find it on the CUNY Foundation website, but I'm also happy to give you a link if you talk to me after the session. But the upshot is the majority of folks with IDD, adults with IDD, that is, are living at home with a family, with their families. It could be parents, it could be siblings. A very small number relatively are living in group homes, and a smaller subset yet are living independently. These statistics don't reflect choice of folks as much as it is just the tightness of the housing market and the limited number of options for folks with IDD to live independently. And because folks in my age cohort, I will say, are aging, and the fact that there's the preponderance of folks in this population live with aging caregivers puts them at pretty serious housing insecurity risk. And so we want to pay attention to that and think deeply about, okay, what are we going to do to make sure our housing market can respond? So that's the very brief setup. I'm going to turn it over to Jake, and he's going to walk you through some of the history, which is not a pretty look for Oregon or the country, but he'll kind of give us some grounding in how we got to this point, and then we'll go from there. You can take that.
Hot mic. Okay, look out. Well, thank you all for being here today at the end of Thursday. I know many of us are probably thinking, oh, God, it's time for happy hour, but I'm glad you're here to talk about a really, really important issue. Again, I'm Jake Cornett. I'm the executive director and CEO at Disability Rights Oregon. And I wanted to kind of ground us in two basic things. First of all, give us some common language to talk about what the experience of housing is for people with disabilities, and also talk a little bit about our history. And in doing that, I really want to start with uh, uh, talking about this in the broader context of diversity, equity, inclusion, accessibility, and anti-ableism. These are some concepts that are central to the disability rights movement. And we oftentimes, using the House framework, think about the disability rights movement as a pillar in the broader civil rights and human rights movement. However, there are many unique barriers that are faced by people with disabilities. So let's start by kind of anchoring this conversation in some common terms. I want to start with the term disability. Okay, this is a legal term. Um, and it's really rooted in the functions of a person. And it's defined as a person who has a physical or mental impairment that substantially limits one or more major life activities. So, for those of you who are not in the disability work generally, I want to kind of break down what this major life activities concept means because it's really broad. And one way to really kind of hone in on it is to think about everything that we experience on a day to day basis as people: work, going to the doctor, going to school. Well, for some of us with disabilities, we face particular barriers related to one of those major life activities. They include things like caring for yourself, or maybe it's working, and that employment piece is where you face the barrier because of your disability. Or it might be a neurological or brain condition that really impacts how you're able to communicate with others on a day to day basis. This is a big, broad term. And why it's important for the housing community is this is a term that lives in the Americans with Disabilities Act. You'll also find it in fair housing law, in the Rehabilitation Act, which extends non discrimination protections to any activity that receives a single penny of federal funds ever. That's a broad area of activity for the housing community in particular. And so, how many people are we talking about? We're talking about a lot of Oregonians that fit into that definition of disability. According to the Center for Disease Control and Prevention, the federal agency that does a fair bit of tracking of various demographic categories, and it's about 1 in 4 people here in Oregon, or 970,000 people. And with that kind of 1 in 4 people, there is tremendous diversity among the types of disability and therefore tremendous diversity among the support needs in housing. For example, I just want to give you a couple of examples to help think about this in more concrete terms. If a person who is deaf is in housing, they may have just a few specific needs to make that housing truly accessible and anti-ableist for them. It might be a flashing doorbell and some clearer sight lines so that they can actually see someone signing to them from a further distance away. And so as you think about that accessibility in the housing environment, it has some natural extensions to both design and also thinking about financing that design from kind of the ground up. Whereas you think about a person who maybe has more significant support needs, they might have a cognitive and an independent living function challenges related with their disability. And they may need one-on-one round-the-clock care. So their needs in housing might be a little bit larger footprint, wider doorways, roll-in showers, reinforced walls in case their wheelchair bumps against a wall. You don't want to constantly be in the mindset of repairing that. And an elevator, maybe a little bit of extra redundancy in the electrical system because they might rely on life-sustaining machinery for their independence. And so I'm giving you these examples because in the housing world, um, it's important to kind of approach this from the person first perspective. What does that person with a disability need in order to live independently and utilize affordable, accessible housing in our communities? And that informs a lot of what we do in the housing space from really day number one of even thinking about a project. And while there's really kind of tremendous diversity within and among the disability community, disability is an identity that really cuts across pretty much every other demographic category. Disability is an identity that has a very large share of veterans, for example. So, as you're thinking about financing and looking at veterans projects, I'd be thinking about disability at the same time as you're thinking about what are the needs of affordable housing for veterans. It also has tremendous diversity among, and I actually want to pause here. There's tremendous historical injustice and discrimination that has impacted people of color for many, many, many years. And when we think about disability, we think about it as a identity that cuts across literally every demographic category. It's the only minority group that you can join at any time through crossing the street while a car is oncoming, for example. And so the diversity that we see among people with disabilities is well represented among people of color also. Um, and I want to give a little shout out to Disabled in here for this great photo that is available free for use for anybody who wants to promote disability identity in their public facing work. This is actually a photo taken here in Oregon, but widely seen throughout the country for those of us who work in the disability rights field. I think that was actually at Community Vision's porch. And so finally, I want to just talk a minute about ableism, because at its core, ableism is a term meant to identify when institutions, systems, and policies, and then the people and their attitudes who are involved in those institutions, systems, and policies create inequitable opportunities and outcomes for people with disabilities. So I want to give you a real example of this, a real local example. So there was a large local foundation here that decided to do kind of a top to bottom review of their grant making. And they hired a group of consultants and focused on what meaningful diversity, equity, and inclusion means in their grant making process. And they promised to do a whole series of community listening sessions and over a multi-year process. I like to call it a soul searching process. And among those dozen listening sessions, not a single one was focused on what are the needs of people with disabilities when thinking about diversity, equity, inclusion, and addressing the social and economic barriers that are faced by our community. And the end product was a funding agenda that focused on social and economic justice that entirely excluded people with disabilities from their priority areas. And the reason I'm sharing this is because this foundation is really not funding work to combat economic and social injustices faced by the most marginalized communities among us if they're not thinking about, including, and being purposeful in bringing in anti-ableism into that lens, that perspective that they're looking at the problems that our community faces. Now, I will say, as a lifelong disability advocate, as a person with a disability, this was not surprising to me that this happened, because when we're not invited into the room to have the discussion, when we're not at the table, when the consultants are hired and none of them are people with disabilities, it's never surprising that the end result is an ableist agenda. And so that's what that term ableism is at its core. It's about creating systems that are not truly equitable, not creating opportunity for advancement for everyone, and are leading to outcomes where people with disabilities are too frequently excluded. Now, I'm not going to tell you who that foundation was. I'm not here to name names, but it's a really important and real example of how ableism plays out every day in our communities, in our societies, and in our institutions. All right. Last kind of concept I want to introduce those of you who are not familiar with the disability movement to is the social model of disability. Now, historically, back in the olden days, we had what's called a medical model of disability. And that medical model said that what's wrong with disability is the person. The person needs to be cured. The person needs to be fixed. But what this social model is about is a kind of a sea change shift. And it's what all international disability law is built on. It's what the Americans with Disabilities Act is built on. It's what Affordable Care Act is built on, and so many other federal and state statutes. And according to this social model, we really look at what surrounds the person that gets in the way of their full meaningful access. And that's the thing that's wrong. And that's the thing that needs to be fixed. And so some basic ideas behind this is that disability is a really natural and normal part of the human experience. It has existed forever and it's not going away. We're not trying to cure people. We're not trying to make them not disabled. What we're trying to do is think about the barriers in our societies, such as inaccessible buildings, sidewalks that don't have curb cuts. And I could go on and on and on with that list. And those are the things that need to be fixed, addressed, and cured. It's not the person. So that's kind of the basic idea behind the social model of disability, that we as a society have a shared responsibility to address those barriers. And now comes the really, uplifting part of my discussion, as if the rest was already uplifting. But those are the kind of the key concepts and terms you need to understand if we're going to have a really meaningful conversation and an ongoing conversation about where the disability community fits in with housing needs in general. And I'm a former school teacher, and I think because of that, I always kind of root ourselves in our history in pretty much every discussion and presentation I give. And that's because to understand the history of people with disabilities, we really need to understand our Oregon history related to people with disabilities, learn from it, and frankly, never repeat it. And I want to really zoom in on housing for people with intellectual or developmental disabilities, people with traumatic brain injuries, and some folks who have serious mental illness. Now, this is a subset of the broader community of people with disabilities, but it's generally the groups of folks who have higher level of support needs related to achieving independence in housing, independence in living, independence in just about every aspect of their life. And their history really informs where we're going to as a community. So this photo is from 1908. This was the newly constructed Oregon State Institution for the Feeble-Minded, a really offensive term that we no longer use, but it's important we understand where we're coming from. And this later became known as the Fairview Training Center. Now, this was a really pretty building, right? Nice, luxurious, big, tall pillars in a village with a pretty little name. But it was more like a prison than a therapeutic environment. And at the Fairview Training Center, people with disabilities were committed for a lifetime of abuse, neglect, segregation, warehousing, usually away from the community that they are a part of and their loved ones. And children and youth with significant disabilities were denied really a loving family-like environment, denied the services they needed to thrive independently. And state, it's not you, it's me too. I can't work this remote. The state's funding really was never sufficient to provide the adequate education, physical therapy, or the supports that people needed to thrive and frankly, to leave Fairview. Now, the Fairview was a place that until 1986, many of us were alive in 1986 in this room, Until 1986, you couldn't leave unless you were sterilized. That was a go, no go point for Fairview Training Center. And this played Fairview and other institutions like it played a really large role in Oregon's particularly shameful history in the eugenics movement. And the same story was playing out at the Oregon State Hospital, the Eastern Oregon Training Center, and other smaller facilities that were scattered across the state. And here you actually see patients being subjected to something that was called hydrotherapy. This was alternating between scalding hot and freezing cold water with the idea that it would cure your mental ailments. This is now described as a form of torture internationally. Come on, you can do it. The one thing I do want to say is I really focused on Oregon and Oregon's institutional settings. And while Oregon really thoroughly embraced this awful practice in a way that a large portion of our community was institutionalized, it was not unique. This was a problem across the nation. And in some states, there is still heavily reliant on institutions that are, while better than the photos I showed you, are still institutions, still places that people are trapped without meaningful pathways out of. So abuse and neglect was really rampant. In a 1-month period, there were more than 650 injuries and 25 sexual assaults of Fairview residents in 1 month. That's shocking. And meanwhile, the state of Oregon was paying $200,000 per resident per year for all of this to go on. So conditions like this is why Disability Rights Oregon was created by Congress back in 1975. We are a nonprofit that serves as a watchdog agency and a law firm for people with disabilities. We provide legal representation to individuals. We litigate both systemically and on individual cases in order to create policy and systems change. And we work to educate policymakers about the needs of people with disabilities and how Oregon's laws can make Oregon a better place for every person with a disability to live, work, and play. And in 1986, we worked with the US Department of Justice to eventually close down the Fairview Training Center. Now, this led to residents being transitioned into the community. And now the options at the time were usually large group homes, a few foster homes, and eventually supported living, because what allowed for that eventually supported living to happen was truly an innovative approach that Oregon embraced. And it was really applying for the first Medicaid waiver to say, federal government, rather than using all that money, we are $200,000 per year per person, to institutionalize people, can we instead use that to provide community-based supports? And the Fed said yes, and that allowed for the state to really begin shifting away from this institutional-based model. And meanwhile, while this litigation was playing out, Oregon was really also beefing up family-focused, community-based, choice-driven services. And services really being driven by what are a family's needs. This was really a radical, whatever it takes approach. And it often involved people who were staff who were helping navigate this really complex system of where state law interacts with Medicaid law, interacts with housing law and conditions, and et cetera, et cetera. But what we were seeing play out is that while this was a great system, there were simultaneously long wait lists being developed. And that's what led a few years later to the acknowledgement that we really need a more systemic approach to support the small group of family support services that existed at the time. And in 2000, there was a long wait list for services that led Disability Rights Oregon to bring another lawsuit called Staley versus Kittauber to create what's called the brokerage system here in Oregon. And this system is a group of providers that are choice-based, person-centered services set on helping people really make their own decisions about their lives, self-determine their own future, and and maintain or increase their independence. That's kind of the basis of what the brokerage system here in Oregon is all about. It's an entitlement. People are entitled to receive these services if you're a person with a developmental disability in the state of Oregon. And it includes things like case management, comes along with the package. And these services are provided by nonprofit organizations, and they're paid for by the state of Oregon under the DD waiver services that I talked about. That's developmental disability waiver services. And nationally, this system is really viewed as a model of service delivery that works well. But it remains really kind of an underutilized partnership for many housing operators. And it's an opportunity for both housing operators and service providers to come together to solve many of the housing challenges that we as a community face. And that's because, in a nutshell, the greatest challenge faced by people with intellectual and developmental disabilities in Oregon is really the lack of affordable, accessible, available housing. And we're at an interesting moment in Oregon. There's more money in this housing system than there ever has been before. And so for years, we've heard challenges about there being too complicated of a system, can't find service providers who can partner up with housing providers. Well, my challenge to all of you is that there are no more excuses. The money's there. Let's figure out how to do it. And a couple of other challenges I have for us is really to move beyond the basic ADA compliance when thinking about development work. ADA compliance is vitally important. I do not want to underscore, I can't underscore that enough. I don't want to strike that out. But if you approach housing development as a partnership with service providers, you will really, really quickly learn what is it that people actually need to live in your units. And that informs design, it informs financing, it informs so many things. And my challenge to you is to find partners, whether or not they're brokerages or other service providers. There's a broad group of folks who are interested and currently interested in expanding and currently doing in-home supports for people with developmental disabilities to live independently. And that's the whole game. That's what this is all about. And as housing providers, we can help bridge that gap, bridge the gap between service providers who are there doing the work every day, have a really great idea of what their clients need in order to live truly independently, and housing developers and housing operators who are in the day-to-day business of making that work. So as we are awash in money, now is a great opportunity for us to be thinking about the future, addressing those barriers to true independence, and realizing that there's this whole entitlement service delivery system that exists that can be partners with housing providers in addressing a lot of those challenges. Because fundamentally, there are a lot of people ready to fill any unit that is built if it's accessible and made available. I do listening sessions all around the state of Oregon, talking to people with intellectual and developmental disabilities. And one of my number one questions is, are you where you want to live and who you want to live with? I have yet to have a single person tell me that they are. So that tells me there's a huge amount of opportunity for, if you build it, they will come and fill that space. So anyway, that's it for me. Thank you very much for your interest in our session. And Matt, are you going to introduce Matt?
No, I'm going to introduce Kurt.
Okay, thank you.
Thank you. Excellent. Let's give Jake some appreciation. Really important grounding, I think. And so where we're going to go next, Matt, you have to wait. I'm sorry. We're going to turn it over to Kurt next, who's joining us via Zoom. Again, Kurt runs the Eastern Oregon Center for Independent Living, and he's going to share a bit about his organization and what they're seeing on the ground today with helping people find housing and find that stable housing and kind of what those challenges are. So Kurt, are you there with us?
I am.
Excellent. Great to see you.
to
You can just say advance the next slide and we'll take care of that for you on this end, okay?
Okay, great. I'm ready for the first slide. Oh, excellent. Oh, well, it's good to see all of you. I am Kurt Toombs. I'm the Chief Executive Officer for Eastern Oregon Center for Independent Living, and my preferred pronouns are he, him. A visual description of me: I am a white male, a member of the deaf and hard of hearing community, and I live with a brain injury that I acquired in youth, racing bikes. I'm a 55-year-old male. I have dark blondish and gray hair. I'm not wearing my glasses today, but I'm in my Ontario office with my bookshelves behind me. On the slide, there is our logo in the middle, and the logo will appear on slides that pertain to EOCIL. It is the seal of Oregon in the middle with EOCIL across with disability access symbols behind the EOCIL wording, and then around the logo is Eastern Oregon Center for Independent Living 1999. Next slide, please. The Oregon Independent Living system is a cross-disability system. It is comprised of the State Independent Living Council, the SILC, the Independent Living Designated State Entity, which is our Oregon Vocational Rehabilitation Services, OVRS, 7 centers for independent living that are across the state of Oregon, the Oregon Commission for the Blind, and other disability entities, individuals, and advocates. The SILC, or the Independent Living System, is responsible for researching, developing, and implementing an evaluation of Oregon's state plan for independent living. And the state plan for independent living is for anyone with any type of disability of any age. Next slide. The state plan for independent living, the SPIL, has one objective, objective 2.4, and that objective is that the IL system will advocate with housing coalitions and partnerships to expand access for people with disabilities. That's not nearly adequate for housing, but keep in mind that there are only 7 centers in Oregon, and the state plan is for all 36 counties, and this is a system that has been underinvested in for many, many years. SILs have a base funding of around $2 million to serve 36 counties. Research tells us that to adequately do that, to provide the core services that centers are responsible to provide to individuals with disabilities in all counties, is around $20 million. And to have a center in each county is around 55 million. So a $2 million current funding and a $25 million base funding is what is needed. So you can see how underfunded and underinvested the IL program is in the state of Oregon. EOCILs, we use the state plan, the State Health Improvement Plan, the SHIP, Healthier Together Oregon, United Nations and World Health Organization research, and vital research by entities that are sponsored by entities like the CUNY Foundation to inform our advocacy strategic plan and total quality management plans that we implement here in Eastern Oregon. Next slide. And a little bit of information about us. The slide that I'm looking at now has the EOCIL symbol at the top. EOCIL initially formed in 1997, and we started providing direct services in January of 2000. We are the only state accredited cross-disability peer and client-controlled advocacy and resource center. We promote systems advocacy, individual empowerment, and self-directed services in Eastern Oregon. Our center covers 13 counties: Baker, Grant, Mount Hero, Union, Wheeler, Morrow, Harney, Sherman, Wallowa, Gillem, and Hood River, Umatilla, and Wasco. Next slide. EOCIL has two primary purposes. We operate the Institute for Disability Studies and Policy, the IDSP. It's the location of our cross-disability research, education, and advocacy, and we provide actionable research for independent living systems around the world. The goal is to provide the research, disseminate that out to other centers, and hopefully have some system changes that improve the lives of people with disabilities. We also, our second priority and purpose is to provide direct services to individuals with any type of disability residing in Eastern Oregon of any age. Next slide. Our systems advocacy and direct services focuses on 5 priority areas: housing, healthcare, education, employment, and accessible culture and leisure. For each priority area, our goal is to remove attitudinal, physical, communication, and financial barriers. Next slide. So last year, our reporting year is from October 2021 to September 2022. We provided services, information and referral services to 1,941 individuals in Eastern Oregon. Our disability peer counseling, independent living skills training, individual advocacy, and transition services were provided to 280 individuals. And this is opening up a plan. Individuals have expressed that they wanted to alleviate some barriers to living independently. They open up a plan, they develop goals and action steps, and they implement their plan. We also provided local, state, national, and international system advocacy, 5,256 hours. System advocacy for us is one of our priorities. We believe that through systems advocacy, we can make real system change. Next slide. So a little bit about the growing crisis here in Eastern Oregon, the housing crisis in Eastern Oregon. The housing inventory is very costly. It's there, but it costs, the value of homes have risen tremendously, and as they have across the state and in many states. So the price of owning a home or moving into an apartment, it's very costly here. Regulations to improve. If you're lucky enough to purchase housing, it can take up to a year to even get permits. Going through the permit process, it's a very costly process, very time consuming. Locating an engineer, the contractors, and implementing the steps that need to take to do any improvements or remodeling. This is important because what happens is increases the houseless and homelessness. The cost of housing increasing has increased houseless and homelessness. It's decreased access to safe, accessible, universal design rental and ownership options. Increase interaction and with law enforcement, and we've decreased access to behavioral health and mental health services. It can take up to 6 to 8 months just to have an evaluation, and then even longer to actually start receiving services. And that is really unacceptable. We've also seen decreased access to healthcare options. In reality, when you do not have a house or a home, access to healthcare, access to mental behavioral health care access to medications is not necessarily your priority. Staying safe, finding shelter. So housing is tremendously important here. And as we enter into the winter months, we do have some temporary housing shelters that are only open from November to April. And so that creates some situations because the weather in Eastern Oregon, as a lot of us know, does not necessarily that is just not a good model. And so we also have lack of trauma-informed housing property management. If we're lucky enough to provide trauma-informed behavioral health therapy and someone goes home and has a trigger or and has a reaction to that therapy, there may be some property damage. For Centers for Independent Living and for us in Eastern Oregon at EOCIL, that's not an issue for us. We go in, we make repairs. That's progress. That's addressing trauma. But for property management, that it doesn't quite understand that. They just see a hole in the wall and then the eviction happens. So next slide. So we developed some solutions. Well, of course, number one for us is systems advocacy. We spend a lot of hours, as I mentioned earlier, doing systems advocacy, trying to improve housing options for people with disabilities. But we've also take action. We have hired our own behavioral or medical health teams to start providing trauma-informed care. Waiting 6 to 8 months for an evaluation is unacceptable. And so we've supported people with disabilities to obtain their degrees, to come back and to work as behavioral and medical health specialists at our facility. We've purchased properties and added 14 trauma responsive housing apartments throughout Eastern Oregon. It's not enough, but it's a start. And we're very aware, we've made certain that it's an integrated housing model so that we don't revisit the past as Jake was mentioning about revisiting history or repeating history. We've hired an architect and we're looking at stat container housing options at our LeGrand property. And we've done program-owned trauma responsive housing. And the housing, I just want to mention, we have a wonderful partnership with our EOCCO, Eastern Oregon Coordinated Care Organization, that's made it possible for us to purchase and remodel homes, and the Measure 110 that has made it possible to purchase housing for individuals with disabilities that use substances. We've also applied for federal grants. We were selected for the HRSA SURE grant. It is a research project to make our housing program an evidence-based program. So we're really excited about the changes that people with disabilities are making in their community at EOCIL. Next slide. That's all I have. Thank you so much. It's good to see everyone, and thank you for allowing me to speak with you today.
It's excellent. Thank you. Thank you, Kurt. So we're going to wrap with Matt Saras from Fair Housing Council of Oregon.
All right. Thank you so much. I'm really happy to be here. My name's Matt Sears. I'm the legal director at the Fair Housing Council of Oregon. I've been there since February, so it's a relatively new job for me. I'm wearing a brown shirt, blue pants, and I'm a white guy with a beard and putting on some glasses because I'm turning 41 on Saturday. So just to get us going today, there's a few things I'm going to talk about. The focus of my talk today is really about ways in which people with IDD are left out of the housing policy conversation. And I'm going to focus on two big policy conversations that happen. One of those policy conversations happens nationally, and the other policy conversation happens locally. The national conversation I'm going to talk to you about is the affirmatively furthering fair housing policy. The local policy I'm going to be talking about is the Oregon Housing Needs Analysis. So I'm going to start with AFFH, and then I'm going to talk about the Oregon Housing Needs Analysis, which has had some substantial, there have been some substantial changes to how our state plans for housing. And that's really what's going to be the topic of that second section. In terms of the federal affirmatively furthering fair housing, I wanted to give a brief history of what the AFFH policy is in terms of, it was first implemented in 1995. It's gone through some dramatic changes or shifts depending on the administration that's in charge. During the Obama administration, there were published some very clear guidelines about AFFH rules that provided a lot more guidance to state and local governments as to how they can implement AFFH plans. During the Trump administration, a lot of those rules were retracted and rolled back. But fortunately, with the Biden administration, they've taken an increased focus on re-implementing some of Obama's rules and also proposed some new rulemaking as well. I wanted to start by also saying that AFFH, or affirmatively furthering fair housing, is something that applies only to recipients of federal funds, but that is a lot of programs, and that's a lot of governments. So AFFH applies to state and local government agencies, and it also applies to federally assisted programs. A couple things I want to say about the proposed rule. The Biden administration has put together a proposed rule that improves the AFFH policy. Some of the key elements of those proposed rule changes include that the new AFFH policy will require programs to take actions, to make investments, and to achieve outcomes that further fair housing. The new AFFH rules will lead to more concrete steps. It will lead to more measurable outcomes, and it calls upon state and local governments and programs receiving federal assistance to contribute to engage more with the community to get more stakeholder recommendations when developing these policies. But the overarching goal of AFFH is ultimately to remedy segregation, to address inequalities, and to reduce discrimination that the Fair Housing Act was ultimately designed to address. AFFH calls upon state and local governments and federally funded programs to engage in robust community engagement. And that means community engagement with people with IDD as well, and people with disabilities. Community members are in a unique position to offer insights into our fair housing issues and our local fair housing policies. The outreach methods that they have should be as broad as possible to try to capture the largest audience that they can when trying to develop AFFH policies. And the AFFH rules that the Biden administration is currently nearing to completion, they also call upon these federally funded programs and governments to make special efforts to reach members of protected classes that historically have been denied equal opportunity. And who are those protected classes? Under federal law, protected classes include race, color, national origin, religion, sex, disability, and familial status. So when recipients of federal funds are putting together these AFFH policies, they have to engage the community, and they have to engage each and every one of those communities. The new AFFH proposed rules also create new accountability measures. And one of those accountability measures is that they now allow the public to comment on equity plans that are submitted to the Department of Housing and Urban Development. The equity plan is the ultimate product that is produced by state and local governments and federally funded programs as part of the AFFH process. The other thing that in terms of accountability measures, the other thing that the new proposed rules do is they provide for a complaint process through HUD. So if you have concerns about whether a state or local government or a federally funded program is actually following through on their AFFH policies, there will be a new complaint process where you can submit a complaint to HUD for further investigation. But AFFH is a critical tool to providing the equitable access to housing opportunities for individuals with IDD. One question that we should have is what actions, investments, and outcomes can federally funded programs incorporate into their equity plans to further fair housing for people with IDD or for people with disabilities? The answer is, among other things, that they should be looking to incentivize the development of accessible dwelling units. Another thing another action that can be taken is to dedicate more resources and funding to permanent supportive housing, or PSH. And finally, the third thing that I would say could be part of these equity plans that would really further fair housing for people with disabilities would be to ensure investment in in-home care. But the next question that I would have is, what measures do we use to determine whether those outcomes are actually being achieved for people with disabilities or for people with IDD? In other words, looking at those three things, incentivizing accessible dwelling units, producing more permanent supportive housing, and investing in in-home care, how do we measure those things? How do we measure the progress? One way to measure progress is to measure the number of accessible units that are developed by state and local government. Another way to measure progress is to inventory and count the types of accessible dwelling units that are actually developed through state and local governments. There are essentially, under Oregon state law, there are essentially 4 different types of accessible dwelling units. I'm not going to go into a lot of detail here, but I'm pointing that out because later in my discussion, when I talk about assessing Oregon's housing needs, it's important to understand that there are different levels of accessibility when it comes to dwelling units, and that it exists on a spectrum. Under the Fair Housing Act, the standards that are set forth for any housing apartment complex or housing development that has 5 or more units, those are referred to as type B units. Under state law, there are also what are called type A units that have increased levels of accessibility over type B units. And then there's also accessible units, that's with a capital A, that has even more accessibility than type A units or type B units. Generally speaking, type A and type B units are also referred to as adaptable units because they're not fully accessible to people with disabilities, but they can be adapted in order to be fully accessible. Another way that we measure the progress towards affirmatively furthering fair housing in these equity plans is to look at the number of housing developments that actually include supportive services and what kinds of supportive services those housing developments are including for people with disabilities. Another measure could be that we are surveying access to in-home care to see whether independent living is being maximized. The amount of dollars invested in wraparound services could also be another measure of how local jurisdictions are doing in terms of affirmatively furthering fair housing. As I mentioned earlier, one of the important pieces of the new AFFH proposed rules is that element of community engagement. So how will these programs engage with persons with IDD or persons with disabilities when developing these equity plans? They're required to make special efforts. That could be disability-specific focus groups, That could mean visiting persons with disabilities where they are, actually going to group homes. It could mean talking to families of persons with IDD. It could mean talking to advocates and service providers that serve persons with IDD or persons with disabilities. And ultimately, it's about ensuring also that those community engagement activities are accessible to persons with disabilities. And how can persons with IDD and their advocates hold programs accountable for their equity plans and whether they're following through on them? Well, one way that we can hold local jurisdictions accountable for their equity plans is by training more self-advocates in the disability community. Another way that we can help hold them accountable is to provide public comments to HUD when equity plans are submitted. And we can also hold them accountable by accessing and reviewing annual progress evaluations, which are required under the new AFFH rules. Lastly, we could file complaints with HUD when local jurisdictions are failing to comply with these equity plans. The next section, now I'm going to shift gears a little bit. So that was a little bit on AFFH, but I want to talk to you about some new developments in the state of Oregon that really happened during the last legislative cycle. So this is fresh, and there are a lot of opportunities for engagement from the community to help implement these changes. And what I'm talking about here is the Oregon Housing Needs Analysis. Fair housing planning also needs to occur locally. And a lot of that planning occurs through Oregon's comprehensive land use planning system. This system has been in place for nearly 50 years. In fact, 2023 is the 50th anniversary of Oregon's comprehensive land use planning history. We're unique in the nation in that we are the ones that essentially developed this entire process of comprehensive land use planning, and we've been doing it for the longest. But part of that comprehensive land use planning is something called Goal 10. Goal 10 is related to housing. The issue with Goal 10 has historically been that it has focused almost exclusively on simply doing an inventory of buildable lands, looking at little more than that. Basically, surveying our regions to find out, how much space do we have to build new houses, to build new apartment complexes, and so forth. But what it hasn't looked at are critical questions about the housing needs of persons with disabilities. And that's beginning to change. And that changed during the legislative cycle that we just went through this year. HB 2001, 2023, I say 2023 because there was an HB 2001 a few years ago that had nothing to do with land use planning. So it gets a little confusing. But it requires local jurisdictions to plan for what is needed in a different way. And it does it through two main mechanisms. One of them is it calls upon local jurisdictions with populations more than 10,000 to do a housing needs analysis. The goal of that housing needs analysis is to determine what the actual housing needs are in their communities. The second big piece of this new legislation is the requirement that local jurisdictions then also create a housing production strategy. In other words, first they assess the need, and then they develop the strategy to meet that need. They will have local housing production targets, and they will also be required to think about equity indicators that have never been thought of before. The Department of Land Conservation and Development, DLCD, will be the one tasked with measuring the progress and holding local jurisdictions accountable for the implementation of their housing production strategies. So I want to go over the accessibility provisions of HB 2001, or in other words, I want to talk a little bit about how HB 2001 addresses the needs of persons with disabilities. It does this in a number of ways. It redefined the guiding principles of Oregon's comprehensive land use planning system, and it redefined those guiding principles to include accessibility, which incredibly had never been a guiding principle of our land use planning system. So now today, we recognize the importance of housing that is not only safe and not only affordable, but is also accessible for people with disabilities. HB 2001 looks to address two key problems. One of them is that there is no inventory of accessible units available in our state. The second key problem is that there is no plan to develop accessible units needed in our state. So we've previously focused a little bit on that buildable lands question. Well, we're flinging the door open. We're not just caring about buildable lands anymore. Now we're starting to care about the actual units that are being developed. And improvements to that inventory for needed housing for persons with disabilities will come through some data. Like, we needed to start to develop the data about what's actually out there and how to plan for it. To help us do that, Oregon Housing and Community Services has been tasked with producing for each city quantifiable data. What kind of data is OHCS supposed to be developing? They are supposed to look at new housing units built to standards related to accessibility and visitability. In other words, OHCS is responsible for delivering to local jurisdictions data about what is being built in terms of accessible housing. The other data piece that OHCS is now tasked with delivering to local jurisdictions is to look at housing outcomes and provide data about cost burden and availability of housing. But specifically, they're supposed to look at cost burden and the availability of housing for key demographics. Prior to the HB 2001, there had been no analysis of the cost burden or availability of housing for persons with disabilities under the comprehensive land use planning system. With HB 2001, persons with disabilities have been added as a demographic that they have to examine the cost burden that persons with disabilities are facing specifically, and they have to assess the availability of housing for persons with disabilities specifically. Another improvement to inventorying the need for housing for persons with disabilities under HB 2001 is that it calls upon jurisdictions to create population forecasts. Those population forecasts are to look forward for 50 years. And prior to this year, those population forecasts never examined disability status, and that has changed as well. So now when they do those population forecasts, they're required to think about disability status as well. The other piece of this is improving the system of planning for needed housing for persons with disabilities. So that goes back to one of the two key problems I was talking about. One of them is inventorying housing. And part of that inventory is understanding what kind of housing is actually needed. So one of the key changes through HB 2001 has been that they've changed the definition of what is quote unquote needed housing in the state of Oregon. Prior to this year, accessible housing was never part of that definition. But now, because of HB 2001, needed housing is defined to include housing for individuals with a variety of disabilities related to mobility or communications that require accessibility features. Needed housing is also redefined to include housing for older persons. Now, one thing that we had fought for, and that is not in HB 2001, is the fact that this is actually a relatively narrow view of housing needs for people with disabilities. Let's think about that phrasing again a little bit. New housing units, so the actual phrasing is housing for individuals with a variety of disabilities related to mobility or communication that requires accessibility features. What it doesn't talk about is needed housing for people with mental illness. Really, what this HB 2001 has done is focus a lot on physical disability. And there's still a huge gap remaining in addressing the needs of people with mental illness through our housing production strategies, through our assessment of housing needs. Housing production strategies are now required to include specific actions to promote housing that is of diverse housing types, high quality, affordable, and most importantly for us, accessible. Housing production strategies have also been changed. So now that they're now required to consider AFFH when they're creating these housing production strategies. And that was also a big win in terms of HB 2001, because that looks beyond just people with disabilities. AFFH isn't just related to people with disabilities. It's related to all 7 of those protected classes that I just mentioned. So the fact that HB 2001 has now incorporated AFFH into our comprehensive statewide land use planning system means that local jurisdictions, when they're performing their tasks in developing plans to construct new housing, they have to consider the whole gambit of protected classes that should be provided housing in an equitable fashion. And there's a specific definition of AFFH in our new state statute, and I'm going to read that to you. The new AFFH definition under state law is, quote, meaningful actions that, when taken together, address significant disparities in housing needs and access to opportunities, and replace segregated living patterns with truly integrated and balanced living patterns to transform racially and ethnically concentrated areas of poverty into areas of opportunity, and to foster and to maintain compliance with civil rights and fair housing laws. So, what does that mean? When applying AFFH through the land use planning process, they have to think about meaningful actions. They have to think about housing needs for people with IDD. They have to think about access to opportunity for people with IDD. They have to think about replacing segregated housing patterns for people with IDD and ensuring that people with IDD have the ability to live in integrated and balanced living environments. The other thing that that planning for needed housing does under HB 2001 is it also looks to local jurisdictions to try to reduce financial and regulatory impediments to accessible housing. The new HB 2001 will also require that they no longer simply focus on essentially what has been focused on before, which were 2 things. Previously they focused mostly on how densely housing was developed and how affordably housing was developed in terms of, affordable housing for people who are going to live there. But now they're required to think more proactively about accessible housing as well. In terms of accountability, localities must report annually on units with accessible features or of an accessibility category under the building code. What does that mean? That means that local jurisdictions are going to now be tasked with producing the data that we need, because we need the data about the number of units of accessible housing that are being created annually. And so this is a key piece of accountability for understanding the number of accessible units, type A units, type B units, and other types of accessible units that are being constructed across the state. Now, we only have a few more minutes, but what I do want to tell you about is a few things that HB 2001 does not do, because there's an opportunity in front of all of us to help in the implementation of this new comprehensive land use planning system. And I'm going to tell you what HB 2001 did not do, because it's part of our job to ensure that when DLCD implements this new statute, that we're telling them the things that they didn't include in the statute so that they can put them in the regulations. One example of this is that HB 2001 does not include a uniform definition of what this statute here means by accessible housing. As I mentioned before, accessible housing lives on a spectrum of type B, type A accessible units. There's also mobility units under Section 504 of federal law. And HB 2001 really, by not defining what that statute means by accessible, has provided very little guidance to local jurisdictions in terms of their need to prioritize the most accessible types of units. In other words, where I think HB 2001 missed an opportunity is that they could have specified that accessible housing means type A units, or it means accessible units, but they chose not to do that, the legislature. The other thing I'll say is that HB 2001 is focused largely on physical disability needs, as I mentioned before. It's not focused as much on mental disability needs, permanent supportive housing needs, and the wraparound supports that people with serious mental illness may need. Both are needed for people with IDD as well. There's also no special priority or prescribed targets for construction of specific accessible housing types. In other words, there's no assurance that the most accessible housing types will actually be constructed. The last thing I want to say about it that you could engage with is to try to argue for there being more of an inventory of the percentage of households that include a person with a disability who lacks the accessibility features they need. In other words, if we're truly going to assess the housing needs of people with disabilities in local jurisdictions, we need to be asking people with disabilities, what are the accessibility features that they're lacking? And HB 2001 doesn't really require this. However, DLCD, the Department of Land Conservation and Development, when implementing this statute and developing its regulations, they can ask local jurisdictions to do that. And there will be opportunities for all of you to participate in this process. Moving into 2024, DLCD will be engaging in rural advisory committees around this Oregon housing needs analysis process. So they'll be looking to you and to the public, to housing providers, to industry insiders, to advocacy groups, and to everybody else to provide input as to how we can implement this process in order to maximize the benefits for persons with disabilities.
Wow. Thank you so much, Matt. Matt Sears. I'm going to practice saying your name properly. We are out of time, but I think I can speak with confidence with my colleagues up here that will hang around. If you've got any questions, you want to come and talk to us sort of offline. We'll stay up here for a few minutes. Thank you all so much for your participation and your interest in these important topics. And let's thank our panelists one more time. Thank you, Kurt.